participation here tonight, so I appreciate that. And so, by the way, you might have noticed at the top of the screen, the recording has started. And let me go ahead and share my screen if I can find it. Well, way too much junk open up here. I'm going to have to narrow this down quickly. So anyway, appreciate everybody's participation. Get rid of some things here so I can actually find the presentation. And you should see that Kelly had sent it out earlier to everybody. So I think she sent a PDF of that out. So you should have that. Let's go back to sharing. There we go. I think I got it right this time. All right, so, and the agenda for tonight, well, it looks like it's going to be another full one. We'll go through some housekeeping right now. Just a reminder to, if you're not talking, to, put your mic on mute. And if you'd like to have your video on, please do. Not required. And like I said, we are recording this. And feel free to use the chat and raise hand functions as well. And now the presenter, like me right now, I can't see when you're doing the chat or the raise hand, but whoever else is not presenting, if you see that and you want to interrupt the speaker, please feel free to. All right, so the agenda here, cover our follow-up items and go through some subcommittee updates. We've got presentation on the North Kent exposure assessment. We'll go through some MPART updates and then talk a little bit about the citizens panel coming up and go through a round robin. Is there anything else that we need to make sure that we cover tonight?
Steve, I'm not seeing your screen.
Uh-oh. Let's try it one more time. Operator error again, huh? Well, I'll stop sharing and maybe try sharing again.
Steve, if you have dual screens, that's where I was getting hung up today.
Well, if I do, it's not intentional. Can you guys see it now?
No.
All right.
No.
My connection might be goofed up a little bit. So, Kelly, do you mind sharing yours? All right. Slowly but surely, I think it's coming up. Although, Kelly, I'm not seeing yours either. Everything looks kind of frozen in time here to me. Is the audio working for everybody?
So it was Kelly's is working for me. She had the presentation up for a minute there.
Oh. Is it still there?
Yes. I think it's you, Steve.
It might be me. So, folks, what I am going to do is really quick, just get out because things are all frozen on my screen. I will jump right back in. So, hold on there.
Well, I'm wondering if Steve says his computer is doing an update conveniently right now. So why don't we jump to DHHS for their presentation?
Okay, thanks, Kelly. So I just want to thank everybody for being here, and a couple of my colleagues are going to give a presentation on the North Kent County Exposure Assessment, the first report, and some of the results that are in the first report. So I'm going to let you take that away, Joost and Rachel. I'd like to introduce Joost Vanter. He's a toxicologist with our program, and Rachel Long, who is an epidemiologist with our program.
Thank you, Deb. This is Rachel Long. I'm the lead epidemiologist on the North Kent County PFAS exposure assessment, and I'll start out our presentation today. And Joost, I think I have control of the slides. Okay, yep. Okay. So today we'll be talking about the first report from the North Kent County Exposure Assessment, and the first report, as well as a summary of the first report, are available at the website you see on the screen here. I encourage everyone to take a look. You can reach it by going to this website, clicking on About DH, and then following the link that says North Kent County Exposure Assessment. Okay.
I'll do it.
Oh, okay, thanks. Should I just say next slide then?
Yes, please. We'll make it
Okay.
work.
All right, great. Next slide. Okay, thanks, Joost. So as many on the call here probably know, this area has many private wells where people could be exposed to a range of PFAS at a wide range of levels. And this area has some of the highest private well PFAS levels in the state. Since PFAS was discovered in the northern Kent County area, the state agencies have conducted a multifaceted response, including MDHHS's exposure assessment. So MDHHS has followed methods from the Centers for Disease Control, Agency for Toxic Substances and Disease Registry, or ATSDR, to investigate the public health risks from this environmental chemical release. And this exposure assessment is one of several activities ongoing in the area at the state, local, and federal levels. Next slide, please. So in the first report that we're talking about today, we covered two objectives of the exposure assessment. The first was to measure and summarize the amounts of PFAS in the blood of people from North Kent County who have PFAS in their private drinking water wells. Second, the exposure assessment aimed to compare the PFAS levels among the exposure assessment participants to those in the general U.S. population. And we have statistics on PFAS levels for the general U.S. population from the National Health and Nutrition Examination Survey, or NHANES. NHANES is a program of the CDC, and it really has some of the best estimated levels of environmental chemicals for the general U.S. population. So in the first report, we covered these two objectives for exposure assessment participants who were age 12 or older at the time that they provided their blood to be tested. So while all age groups participated, from very young children to, through adults, the focus of the first report was on this age group because this is the group that we have the most NHANES comparison data for. Next slide, please. So households were eligible to participate in the exposure assessment if they were on a private well tested by or at the direction of EGLE, and if they had a detectable amount of PFAS in their well as reported to MDHHS. Of the over 1,700 addresses that have been sampled in the North Kent County Environmental Investigation Area, 773 houses met the eligibility criteria. These households were divided into two strata, or two groups: households whose pre-filtered drinking water well sample contained less than 70 parts per trillion total PFAS, and households whose pre-filtered private drinking water well sample contained greater than or equal to 70 parts per trillion total PFAS. All of the households in this higher exposure stratum, the 182 in the greater than 70 parts per trillion group, were recruited or were selected for recruitment. And then a simple random sample from the low stratum households was selected for recruitment. So that was about 40% of those lower stratum households. We invited 100% of the higher stratum households because we wanted to be certain we had enough representation of the people who had been drinking higher levels of PFAS in their water. Next slide, please. So 183 of those selected eligible households ultimately had individuals participate in the exposure assessment. And from those 183 households, 432 individuals enrolled in the study. Of those, 427 were able to provide a blood specimen. 413 of those individuals were fully eligible for the study. And then we divided that group into those who were less than 12 years old and those who were 12 years old or older. And the focus of the first report is on that 12 years old or older age group. I'll go over here the demographics of those in that 12 years and older age group who participated in exposure assessment. The average age was 50 years. Slightly more females than males participated. This was a relatively highly educated group, with most adults having attended at least 4 years of college. This was also a relatively high income group. Most adults reported an annual household income above $75,000. And the vast majority of participants were white and non-Hispanic. I'll now turn the slides back over to Joost to talk about the blood PFAS results in the first report.
Oh, thank you, Rachel. So my name is Joost Venter. I'm the toxicologist for the North King County Exposure Assessment, and I'm happy to walk you through some of the results that we have. Just like Rachel, I highly encourage you. We have a one-page summary as well as the full report available on our website. So I'm only going to cover the time that we have only allows us to cover a small bit of the results that we have. So please do look at that full report or ask us any questions at the end, and we're happy to share more. So to give you the quick high-level overview of what we found for the PFAS levels in our North King County Exposure Assessment participants' blood is that for some of the PFAS, we did find higher than expected levels when you compare those blood results to a general U.S. population. Some of the PFAS we actually could not compare, and here's a list of those. The reason for that is they're actually not part of NHANES. They haven't been measured yet in the general population. I'm hoping one of these soon they'll add these to them so we can have that comparison. But right now, at this point in time, we have the data. We can see that some of these PFAS are found in people, but we don't actually know are they higher than you would expect or not. For some of these PFAS, we do know this, such as PFNA, PFHPA. These were found in blood of some of our participants, and in some cases most of our participants, but the levels actually aren't any higher than what you would expect in a general U.S. population. So even though they're in the water, they're not any higher than what we'd expect. These PFAS here on the right are the ones where we do see higher levels, so PFHXS, PFOS, PFOA, and MIFOSA specifically are the few PFAS that we analyzed for. We analyzed 30 PFAS in total. Of those 30, these ones were the ones where we find higher levels than expected. And I'll elaborate that in a little bit more, what we mean with higher than expected. So the first comparison that we did was looking sort of at how many people are at the high end of blood level that have higher levels of PFAS in their blood. And again, this is based on the specific PFAS. So for PFHXS, we compare against that NHANES, which is that general U.S. population representation. The level that we compare to is the 95th percentile. So this is a level that only 5% of NHANES participants have a level higher than. So it really means it shows you that upper end of what to expect in a person. These levels have nothing to do with health impact. So somebody that has a level over this, it's not automatically higher risk. They just have a much higher level compared to many other people within the United States. And by definition, we'd expect that 5% of people have a level over this. So it's not even unexpected if you are over it. But what we can do is we can compare our population and compare this other one. So if the two populations were equal or lower, we would expect 5% or less. And that's what we saw for some of those PFAS where we said there was no differences or they're actually lower. But for the PFAS where we see that they're higher than expected, we see a larger amount of participants. For PFH-XS, that's 33% of our participants have a level higher than its 95th percentile. So for this specific PFAS, we can say that the blood levels within our participants, for at least 33%, they have higher levels than we expected. We also see this for PFOA, and it's important to note that each PFAS has a specific 95th percentile, and that changes over time sometimes. So from different study years of NHANES, we see there's a decline in that 95th percentile or even the average amount of PFOA in the blood. So for each PFAS, we have to look individually, what is that upper expected level, and make that comparison. So for PFOA, it's 29%, and for PFOS, it's 17% higher than its 95th percentile at that 18.3 micrograms per liter. The only other one that we saw was MIFOSA at 7.2. Again, the comparison is against that 5%, so 7.2 is technically higher than 5. We can't yet do any good statistical comparison of this, but it's worthy to note that even though it's not much higher, it's still higher than what we would have expected. So another comparison that we do is looking even further at that distribution, so the averages and the maximum of the PFAS levels in the blood. Again, these specific PFAS, looking at each one individually. So if we take PFH-XS, for example, the North King County study participants on average had 2 micrograms per liter in their blood, with the highest level reported at 884 micrograms per liter. If we compare this to our NHANES participants, we see that there's a slight increase, next to no difference for some of these PFAS of the average, meaning that most people actually don't have higher levels than the general U.S. population for these specific PFAS. And that's, that aligns with what we saw, where it was only 33% actually have higher than 95th. So even though it's more than you expected, it's definitely not everybody. And that's probably the case because we had this relatively unique exposure in the North King County area, where everybody has, or all our participants at least had, private wells. So everybody was drinking a little bit different amount of PFAS. There was a wide range that was reported for PFAS in the drinking water, and the specific congeners even. So it's no real surprise that there's a big range from very low to very high of these blood levels that mimic the results that we see in water. And based on this, we're really going to explore in the second report that we're now working on what that relationship actually is, and can we make any more stronger or deeper conclusions based on what we see here. Another reason, or another sort of clue that this exposure is different from what we've seen in other places, is that if we look at other communities with contaminated drinking water, and here we're summarizing a couple different studies, thinking of Parkersburg, West Virginia, sites in Minnesota that had also contaminated drinking water supplies. Here we see the effect of municipal supplies, so large city towns impacted by a common source of PFAS, so high levels or even medium levels for many people to drink the same contamination. And you see a tighter range, even though everybody is higher because more people drank the same contaminated water. On average, more people were impacted, whereas in North King County, we had that difference in the PFAS levels based on what's in your private well. But that resulted in sometimes the maximums being lower because there's not that huge range of PFAS contamination from well to well, so to say. And that's very consistent between the different PFAS that we're summarizing here. The last note is that we're compared to workers in PFAS industry, and the takeaway here is that we see very large differences in the average and the maximum compared to our study participants, other communities, and even the NHANES for all three of the PFAS that I'm showing you here. This is very telling that an occupational exposure is very different, leads to very different ranges of PFAS in the blood compared to a drinking water exposure. And that becomes very interesting and important to understand the health effects that are coming later. So it gives us extra confidence that the health studies that I'll be talking about in a minute, where we're going to study the health effects of a drinking water exposure, are very important because they do show different levels than your occupational exposure, where most studies are based on at the moment. So really adding that drinking water component is necessary, very, very necessary. Oops. So in summary, the PFAS blood levels that we found in some of our North King County participants were higher than what we'd expect in the general U.S. population, and that specifically includes the PFAS, PFOA, PFOS, and PFHXS. But keep in mind that for most of the PFAS that we had a comparison level for, we didn't find any differences, or they were at least in the same range as those as a general U.S. population, and not everybody was impacted by these high levels. Definitely more than we would have thought it would, but not everybody. So what are we working on next? So we're summarizing. We did collect water samples for every single well of a household that participated. So we're going to summarize those, look at factors that describe how the PFAS levels are affected. So water use, filter use, fish consumption levels, examine then the connection between the drinking water levels and what you ultimately see in the blood. So that's going to be very interesting. And then making any additional comparisons to national averages or other groups with our data. And like I alluded to, what we're working on now is the public health investigation continues. We've now documented in our exposure assessment that there are people with higher levels of PFAS than we'd expected, and now we need to understand what the long-term health impact of that is. And for that, we're going to conduct 2 health studies. So we have the Michigan PFAS Exposure and Health Study, and we've been awarded a grant by the ATSDR, where we're one of the 7 sites in the multi-site health study. And these are communities all over the United States where ATSDR is providing funding to recruit people in their health study. There's going to be a core protocol. At the end of the study, all the data will be combined, so we have a diverse range of socio and economic factors and different exposures to PFAS, hoping to get a very comprehensive addition to the research that's out there to see what is the impact to the health of individuals that drank contaminated water, really focusing on that health question. So MIPES is expected, so our Michigan-led health study is expected to start this year, hoping to hold our first clinic and start recruiting people very, very soon. We'll invite these people, so there's 2 eligible areas in Michigan, the city of Parchment and Cooper Township, and then the Belmont-Rockford area, which was the site of the exposure assessment. And all the eligible people that at least we are aware of will get a letter from NDHHS inviting them directly to the study. So we're hoping that there's going to be lots of participation. We're going to invite people directly, hoping that goes very, very well. And really the last point I want to make is that even though we're focusing only on these 2 areas to be included in the study population itself, really the conclusions that we're going to draw are really not just going to benefit those people that participate in those 2 communities, but we really want to understand how PFAS impacts health, and that will benefit all Michiganders, even if they weren't directly included in the study. And with that, I thank you very much, and I'm happy to take any questions.
Yeah, Yost, I see Sandy had her hand up, I think on slide 16.
Okay.
I can't help myself. You know me. I was just intrigued by the people that worked in the PFAS industry and how high their levels were. And I'm doubting they weren't like sucking on the Wolverine shoes or, drinking the Scotch Guard out of the bats. So would that indicate that there's more risk than maybe what we had realized with either, airborne contaminants or skin contact, or any theories about that? Because we were just on a call talking about that.
Sure. I think that's not a crazy conclusion. I don't think we have the information to truly say that was the only exposure they would have had. I think it ultimately led to very different levels than the drinking water exposure, and that's where I'd go with, they're definitely different. Why they're different? I'm not fully. Deb, do you have any better answer?
You don't have to have an answer. I just think it's
That's all
worth
right.
looking
No, I think
into.
it's a good
Yeah,
question.
it is interesting. So I think it'd be good to go back and look at the individual studies there and see what the different occupations were and what type of exposures they could have had. So keep in mind some of these levels that are in the so we do start getting concerned about dermal exposure when you get to higher concentrations in products rather than the kind of concentrations we see in water. Impacts to drinking water, impacts to the surface water bodies we've seen. We know that with PFAS foam and recreational exposure, we start getting concerned for dermal exposure for a young child when we get to about 100 to 200,000 part per trillion over a summer of being exposed 5 days a week, 12 weeks a year. So it is all dependent on how frequently, how high the concentration is, and things like that. And then the other question would be, some of these exposures may have been, I know some of them are like misters or things like that, where it's not like, it's more of a mist rather than something that's travel. Yeah. The inhalation may be different than what's in water. So, yeah. But I think we'd have to go back and look at those. I'm just speculating at this point. So
it's a very good question.
It is a very good question. Does anybody have other questions?
I see some comments in the chat. Bob Pataki saying wow and great work, and then Brandy's also pointing out that EPA says reverse osmosis water systems are effective. Yep. Okay. Thank you.
Yeah, thank you very much.
Thank you.
Awesome. All right, and I think Kelly is probably going to take the screen now and go back to a few slides that we can cover where I got cut off. It was probably operator error, but I had to reboot my whole system, so sorry about that. All right.
I'm just trying to figure out where we're at here again.
But basically we'll jump back ultimately to the follow-up slide, and that, I think was a great suggestion Sandy had before a couple meetings ago, is what sort of follow-up items did we have from the previous meeting, and there was really a couple hanging out there. One of them, Tony had submitted some questions about the PFAS report back a couple of meetings ago, and I said we would, go ahead and get a response to that. And I've talked with Tony. I need to, check in with him some more just to make sure that we're being responsive. So stay tuned for that. And then there was also a lot of conversation about all of the investigation work that's going on in Southeast Michigan, and that we really haven't done a good job, MPART hasn't, of kind of putting together the total picture, the story like we do for like the Huron River watershed. and do those municipal updates, letting everybody know everything we're doing from, source tracking and identification, investigation, remediation work, et cetera. So we've got some work going on right now in the area, and I talked with our water resources folks, was hoping to maybe get something in November, December. They're taking some more samples in October. And so, as you know, it takes a while to get that data back and then for them to kind of digest it. So right now, I've got a commitment from them, if all goes well, that they can give that presentation right after the first of the year and really kind of highlight what all the work that's going on there in both, especially those two watersheds. But then I think as well, we recognize a need to kind of address questions on the bigger picture in Southeast Michigan, kind of Detroit area as well. So Daniel Brown also mentioned, just the benefit of kind of compiling all that data, putting it out there for that, putting it all in context. Were there any other follow-up items anybody has in their notes? Those were the ones that Kelly and I had in ours. All right. Well, thank you. And I think we can jump on to the next, which is actually the subcommittee updates. And we've got Ken, your committee on engaging the public subcommittee, and then we can jump when you're done to AJ on the web review subcommittee.
Okay. We have been meeting an hour before these meetings for the last several months, and we're still struggling to put some formality to our agendas, but we're getting an awful lot of support from State of Michigan, Department of Health, and you guys. And I think part of the reason we're struggling is that we have the COVID lockdown and virtual meetings, and we're not able to get a lot of participants. We don't anticipate a lot of participants if there are virtual meetings that are going to come on board. So that's part of our struggle. But there's going to be a big need, we understand, to be out there shoulder to shoulder with the state as citizens when new hotspots pop up, and when some of these locations that we already know are hotspots will be out there, very much concerned with the testing of the residential wells when they start going into those areas. So we have been meeting, and we will continue to meet. Next meeting we'll be discussing a little more formality around what we're doing with our committee and formalizing agendas, and then producing some kind of record of those meetings. So that's where we are.
Okay, any questions for Ken? Yeah, Bob Pataki.
Be quick and short, Ken. Are you seeing any pushback similar to what's going on with the virus measuring and the some of the public opposition to the idea that we actually have a problem? Are you seeing any spillover into the PFAS issue? Did that get through?
I heard you.
Okay.
I don't know if it made it through to Ken. Ken, did you?
Yeah, I heard you too. We're not hearing anything because there's so little face-to-face meeting, and and one of the things I brought up at our meeting was that there's often in dealing with what they think is happening, and that's not always the reality of what's really happening. And I guess if you ask that question to me another way, I would say COVID takes a much bigger in people's lives right now than the environmental impact of PFAS.
Well, just as an anecdote out here where I am in Brighton, the attitudes are very anti-mask, and they deny a lot of this. A lot of people are denying many of the health aspects of the issue, and they are the same people who are dealing with some of the PFAS issues also. And I just sense a more of a disregard or pushback. But as part of a group that's going to be trying to sell this issue to the community in the future, your committee has a real task in that issue. So just wanted to make the comment, and thank you for the work you're doing.
Well, you're very welcome, and I would just say that we probably have the champion of champions on our committee to help us with that, because Sandy has been through hell and coming out of it.
Great, thank you.
All right, any other questions? All right, thanks, Ken, and your subcommittee. Really appreciate that work. And I think we can go on now to AJ and the Web Review Committee. The floor is yours.
Greetings. Yeah, there's not a whole lot of specifics to report. We have been asked as a subcommittee to provide information with respect to the drinking water tab on the MPART site, as well as our role is expanded a little bit to also provide comments on the Eagle site, all intended to really provide input to make the content more easy to find and more understandable. And when you have as much information as MPART and Eagle have packed onto their websites, I mean, it's just it just keeps getting bigger every single week, every single month. It's a daunting task, and we appreciate the opportunity for input. It doesn't really lend itself really well as far as reporting back to the larger COG, because we tend to roll up our sleeves and really kind of get into the weeds on this. So I guess what I would encourage people to do is, right now we just have a few people on our subcommittee. It really is interesting and rewarding. I mean, the folks at MPART and at Eagle and at DHHS, everyone involved on the government side really takes, I think, our input to heart. And there's been some, significant modifications based on that input. So I would encourage anyone that wants to participate, and it needn't be for every call, but we'd love to have you participate in our subcommittee. So if you are interested, it's not something that takes a whole lot of time, 1 or 2 calls a month. It would be great if we could get additional points of view. And, I thank my fellow subcommittee members who have come up with some, I think, great ideas and wonderful insights. So apologies for not having a whole lot of specifics, but again, would really appreciate anyone that wants to spend some time taking a critical look at things and seeing how we can make this huge volume of information more accessible and more understandable.
All right. Thanks, AJ. Any questions for AJ? Yeah, no apologies necessary for not coming in with specifics. You're right. Some of this stuff, it's a lot of busy work may not be the right term. It's a lot of reading through stuff and providing your perspective, and we really appreciate that. We need that kind of other set of eyes on it. Kelly, do you have anything else on the subcommittee work?
I don't.
Okay. All right. Well, if there's no other questions on the subcommittees, let's move on to some MPART updates. One of them is on foam. And just wanted to get everybody up to speed here and, give AJ kind of the warning that there will be some more work coming your way. Perfect segue is we're trying to update the information on the web like we've been talking for the past couple of meetings on foam, surface water foam. And so we've redone some stuff, like including, we're putting the data out there now that we've had. Everybody says, let's get the data. And something to highlight now is we've got the actual surface water data included with the foam data when we collected those both, and to help put that in perspective. Also the messaging on, what the state is doing now when it comes to, reports, sightings of foam, whether we do or don't sample that foam, and also how we're using that information to help guide our source tracking surveys in the future. So anyway, I think AJ, this is going to be headed your way. Kelly is going to work with you guys to ensure that we've got some clear messaging on this. And but also the overarching message here, statewide, is everybody just stay out of the foam for so many reasons. And if you get in the foam, rinse it off, and don't let your kids and pets play in it. So anyway, any questions on that, or Kelly, anything else you want to add?
No, we're working on the web write-up. We should have that finalized hopefully tomorrow morning. So I hope to get the final content, as far as we're concerned, shipped over to the web subcommittee, just so that they can make sure that our message is clear and general public can understand.
Perfect. All right. Well, if there's no other questions, I see a hand raised. Lynn McIntosh, go ahead.
Can you hear me?
Lynn, I can't hear you yet.
Okay. Okay, hold on.
That's getting better.
Can you hear me now?
Yes, we can.
Oh, okay. I have just a quick question. I probably could look this up, but I feel a little lazy here. When I see foam, I've been taking photos. I plan to submit them to the people at Eagle who are collecting that data. But I have a general question. If you see a lot of foam on a water body or in a creek, is that reason to believe that groundwater would also be contaminated, or not necessarily? That's been a point of confusion for me.
Yeah, well, I would say not necessarily, but also I know we've got some folks on here that are really familiar with some of the foam, lake foam sightings reports. And like Mike Jury, if you're on, do you want to chime in on that a little bit?
Sure.
Mm-hmm.
The answer to your question is not necessarily. You have a source, a point source with PFAS in it. So think a culvert or something that may contain water with PFAS in it that could create foam. So not necessarily, not every time, and not every foam may have PFAS in it.
Right, yeah.
So, although my guess is that most foams in Michigan will have some PFAS in it. How much is some? We really don't know because we haven't taken enough samples. So I saw there was a question by Arnie from up in not Taos, but Oscoda. So Arnie, the answer is it's in peer review. It's being reviewed by the state of Minnesota, the state of Wisconsin, Western Michigan University, Michigan State University, staff from Eagle, staff from MDHHS, and staff from DNR. So it is being peer reviewed by all those different folks. We hope to get the answers back from all of them so that we can put the report and get it finalized. I'm still waiting for my results from Wisconsin and Minnesota. They have foam issues also, in those states. We wanted them to have a chance to look at it and get a feel for it.
Okay. All right. I was recently up at Portage Lake in Onekama, and there's a huge swath of foam along the western shore. It reminded me of what you would see at in Oscoda, and I'm looking at this and I'm scratching my head, like, where could this possibly be coming from, all the way up there? So, and everybody there's on well water. So, yeah, I guess I'll submit that information to you with my photos, along with others.
This is Dan. Yeah, I can just quickly add a little bit of context just from what we know from the Huron River. So yeah, we see a lot of foam, particularly in the spring, and then also late fall, kind of before things freeze. We can often see a lot of what we would call organic, natural river foam.
Yeah, I know what that is. Yeah,
and you know it's common to get like huge swaths of that.
Yeah,
It, as you know, it looks different.
Yeah, this is shiny white meringue. It looks just like all the other photos I've seen.
Yeah.
So and I've seen it a few times now throughout the summer. So I you know.
Yeah, but we also we have been seeing a lot of that shiny white shaving cream type foam as well. And we've been talking with Mike Jury and you know other folks at the state about that, and trying to get samples of that. I have also been noticing it as I venture around the state, and you know just as I'm doing hiking and exploring and you know checking out lakes and rivers and other things. You know, I do see very questionable foam. So my guess is that there's something that is behaving like a surfactant, whether or not that's a PFAS chemical or something. You know, I do see a mix of that organic river foam and what looks to be less natural. And I try to get pictures of it as well, but I'm not always successful.
Yeah, no, that's fine. Yeah, it's tricky. I'll keep sending. I mean, I'll start sending. Actually, I've been collecting them, and then go from there. But thank you.
Yeah, thank you both. And I see Brandy's got a question of actually if we've done any PFAS foam sampling on the Kalamazoo River. And I can't scroll that screen, but I don't know if there's any data on there from Kalamazoo.
No.
Okay. All right. Yeah, Christian, I see you had your hand raised.
Yeah, I just wanted to say there's a process now for submitting, foam reports, and that's done through My Waters. And those are handled by Water Resources Department. So just making people aware of that. They're no longer going through the PEAS line, they're going through My Waters. So those are all submitted online. I did want to say as well, a lot of these white foams that we're seeing, we've seen them on the Bear River near Petoskey, and sampling was just done there, and all surface water was non-detect for PFAS. So I think likely a lot of, white foam that's seen throughout the state, was likely there before the presence of PFAS as well. But where PFAS is present now, we're seeing PFAS present in that foam.
Okay, that's very helpful. Thank you.
I see, and thanks, Christian. And then I see a question from Arnie. And Arnie, I don't know if we have the answer on, but Mike, if you can see that and how any of the data you have fits into what's going on in Oscoda. Might just have to follow up with you later on that one, Arnie. Mike, did you have any comments?
That would be a question for Beth.
Yeah, that's what I was thinking. We'll have Beth follow up with you, Arnie. Okay. I'm not seeing any other hands or questions here. Let's move on to just quick update. Many of you might have seen, the state, announcing that a budget deal had been reached, and there, might be some questions or confusion on some of the numbers there. All in all, Eagle did, and MPART agencies did pretty well. We actually got another $500,000 into that 69 to the total of 69 million that's used for cleanups, not just PFAS, but it is important, because we're trying to integrate PFAS into all of our work. And we got 450,000 specifically to help address some of the parchment contamination at their water treatment plant, and $600,000 one-time funding for the Green Ooze site on I-696 over in Madison Heights. We can go on to the next slide. And so these are the ones where I think there might have been some confusion. It looked like the legislature cut $120 million in funding for infrastructure, drinking water infrastructure initiatives. That was one-time funding last year, and it's already quote unquote encumbered, and we're working on making those dollars available, but it is one-time funding, so it doesn't carry over. So the legislature really didn't cut it, they just didn't put it back in for a second round. Now that doesn't mean in some point in the future they won't see the need. I think some of these proposals that we'll be getting in here over the next year or two will show a need for ongoing funding. And of course, that's not the only source of funding for some of these infrastructure projects. Also see that it did not include $2.2 million in DNR's budget. And from talking with Tammy, and I think she's on here, most of that money was for CWD, but it also mentions PFAS. So didn't want it to look like $2 million was stripped out for PFAS studies. And another 300,000 was cut for GIS, and the kind of support we get for working on our PFAS and other sites. Just wanted you to know that we don't see that really having any implications for our investigation work. That's more of an IT kind of thing that we don't see any real adverse impacts from. So anybody have any questions on the budget? All right, I think all eyes are on the development of the next one. And so, stay tuned on that, because I think some of the issues are continuing with the funding questions. So let's move on to, everybody should be aware that we just wrapped up 6 regional webinars back in September, began the first full week and ended the last Monday of September, really just trying to inform the public on those 38, initially the 38, but it turned out I think like 49 new sites total across the state since August 3rd. And this gives you a breakdown of how many people attended. Yes, we would have liked to have seen more participation on that, but I think as quickly as these things were rolled out, I think that's pretty good participation. And in many cases, there's going to be individual community participation in town halls as we go forward with investigations that require off-site work. And we've kind of talked about that in the past. So, but one of the things right now that somebody got stuck in the lobby. There we go. One of the things now that we wanted to kind of chat with you a little bit about is, we spent a lot of time over the past couple of years developing and refining our protocols on when we go out and do town halls, and I think we've been really successful in communicating with the public when a site becomes a site, so to speak, an official site, and requires off-site investigation work. And we've refined it down to do we do a town hall before we start off-site investigations, or if it's something of immediate concern, we start the off-site investigations and then do a town hall as we start getting data. And we might do a series of town halls as we get more information in. But going forward, especially as we have some of these new PFAS sites, we're being questioned on whether or not the town hall format is the most appropriate in every community, or if we might be better off doing something else to reach out to potentially impacted residents. And there's a couple of things that kind of come into that. One of them we found in some of the outlying regions of the state. We've heard back and you might want to make sure everybody's on mute if you're not talking, because we're getting a little feedback. Thank you. And getting some input from local officials in outlying areas. They're like, you're not going to get participation from folks in this part of the community because they don't have internet access, and they may not even have computers. You might be more effective, since we're not doing in-person meetings, is calling these people and spending some time with them on the phone and explaining what's going on, especially if it's only a few potentially impacted residents. So, we're working with locals and the MPART team, and this is something, and I think, Ken, we're going to want to, run through your committee as well to get a better understanding that we can put out to our team on options, what might make the most sense for a given community in a given situation. And again, going back to the participation we had in those regional webinars, we're wondering if the right people are getting the notice, how well our advertising is working. Now, we've tried to reach out through local environmental groups and others, but I think that's something else that we need to look at, is what is the best way to make sure the word gets out. Especially when we're doing virtual town halls, we don't have to spend a lot of time finding a facility and getting our staff from point A to point B. We're all doing this from our homes, and so I think that's something else we have to think about, is perhaps not rushing this too much in some cases. So AJ, I see you got your hand up.
Yeah, I was just wondering, Steve, what was the general attendance to these? Like, maybe, I imagine it was probably variable, but the most attended, the least attended, the average, just ballpark. It looks like it's right there, right? Okay.
Yeah, and you can see some were attended better than others, and I don't know if you can really read too much into that. In some parts of the state, you got people who have been dealing with the PFAS question for quite some time, and that might have played into it. And because, again, all the information about these new locations has been put out on the web and being maintained there, and I think some people know that. And in other areas, again, I'm not so sure the internet access was there. We do make sure that people have the ability to call in. Of course, they don't benefit from any of the visual part of the presentations, but we do try to accommodate just using the phones as well.
Yeah, 39 people for all of northern Michigan is kind of, I know things are kind of spread out up there, but that's kind of a scary number.
Yeah.
Low.
Exactly. And like I say, some of these numbers, I don't want to read too much into them, but again, we do need to better understand why they kind of fall outside of where we thought they would. Also, coming on the heels of this, our staff did a community-specific town hall. And I think if you subtracted out the state staff participating, either as attending or actually doing the presentations, we might have had 4 or 6 people from the community. And this is one where we were going to start doing offsite investigations of residential wells. And so that was a little concerning too, that we might not be getting the word out on these appropriately. So,
one thing that I wanted to add on these numbers do not include any state employees.
Yes, thank you. And I thought I saw Sandy's hand go up.
Yeah, I was gonna just say, I knew about these meetings because of this meeting and all the other PFAS emails I get every day, but I really did not see much advertised in the Grand Rapids area about these webinars anywhere. I don't remember seeing it on social media or anything. So yeah, maybe we got to brainstorm on how do we get the word out to communities to get these going.
Yes, I agree. I agree. I think we're going to, look to you guys for some advice on that as well. And plus, we've got a pretty good communications team and need to maybe kind of noodle over this a little bit as well and see what options there might be that we can leverage. So thank you. Any other questions, comments, thoughts? Again, Ken, I think this is where we're going to be, looking to you and your subcommittee as well. To come up with some recommendations on this. And Bob, I see you got your hand up.
Yeah, didn't want to talk too much, Steve, but I recently attended one of these online meetings regarding the dam report, the report on the dams in Michigan. It's a huge report, lots of experts making recommendations. They were rolling it all out. My point is that there were only, they thought it was very amazing that they had 100 people online for that particular report. And so, and that included your boss and your other boss and a bunch of people. So I think your attendance here, particularly in our current times, the situation that we're in, was actually pretty good, better than most. So I wouldn't be too disappointed about it.
Thinking positive, right?
Yeah, you. Exactly.
Appreciate that.
Okay.
All right. Any other questions? All right, so stay tuned and let's move on to the next one. And this is the Great Lakes Virtual PFAS Summit is, coming up at the end of the month. And I think I sent out to all of you a code where you can get comped if you want to register and participate in any of it. It's free to you. Just please don't pass that comp code around. And you definitely want to participate on the 29th in the afternoon at 3 o'clock, because that's when several of the members of the COG are going to be participating on a citizens panel. And right now we're in the process of kind of, developing a script, for lack of a better term, kind of to run a show on, including things like what sort of underlying themes do we want to have? And I've just really abbreviated that here. But the importance of transparency and kind of the technical discussion versus making sure that regardless of the technical arguments for why we do or what we don't do, that we're not dismissing, residents' concerns, public health concerns, and the overall importance of an informed public across the state, regardless of whether they're part of an MPART investigation or not. And so, again, I'm really looking forward to this. I've got a very minimal role. I just get to introduce it, kick it off, and then I suspect we'll, get some really good questions. This is the only presentation or session of that summit, really, that where folks like yourselves have an opportunity to reach out to, really what's going to be technical staff, consultants, industry folks, regulators, utilities. So I think it's going to be a really important opportunity to message to them on what concerns you all on a regular basis. And so let me ask any of the panelists if you got anything that you want to chime in on as well. I see several are on here today. All right. Well, hearing none, again, looking forward to this and appreciate the participation. All right, so we can move on next to agency updates. And I see a number of different agencies on here. And so in no particular order, wanted to jump over to Tammy, DNR, see if you have any updates for the group.
Yeah, good evening, everybody. Just take a quick minute to update you that our study that is funded with Purdue University to take a look at the Clark's Marsh ecosystem. It's looking at essentially how the different PFAS move through the web chain or through the food web, everything from algae all the way up to turtles. They have completed their field sampling for the year. So they will be busy this winter analyzing those results and developing a model that just, it creates a concept of understanding of how PFAS may move and accumulate through the system. Give an example of why this is important. We did a similar type of exercise with a virus called viral hemorrhagic septicemia. And we did tracking it in a lake in the middle of Michigan. And what we found through that was very surprising. We found tiny little crustaceans, macroinvertebrates, well, not macroinvertebrates, but small crustaceans were a reservoir for the virus. We had no idea that the virus would, and they were down in the bottom of the lake, in the benthos, in the muck and sludge. We had no idea that the virus could stay alive, let alone be in these little organisms. So that's sort of what we're looking for with PFAS in the Clark's Marsh is an understanding of where does that PFAS reside, where doesn't it reside, and then helping us predict how it moves through the food web, because that will help us understand not only what we might predict with any kind of remediation efforts in Clark's Marsh, but it'll also inform us in other places throughout the state where we may need to look for PFAS reservoirs, if you will, to understand what's happening with the fish and wildlife in that area. The second study is very similar. It's with the Huron River. Let me back up to the Clark's Marsh. Those folks will be presenting, Purdue researchers will be presenting just the concept of their project and what they've done to date at the meeting, town hall meeting. The other study is with MSU. Their study did not start in the field this summer. Their study is regarding the Huron River, so looking at that very flowing system, which then has some lake places where PFAS could get hung up for a while, but trying to understand how PFAS is moving through that flowing system. So they are starting with, again, a bunch of literature information review to try and develop their conceptual model, because once again, we'll be able to develop this concept of how we think the different PFAS may be moving through that system to help us look to the future. So those two things are there. The Wildlife Work Group website is up on the MPART website, and so it talks a little bit about each of these studies there, as well as references all of our reports from the past. We're still waiting for the analytics on the deer that were sampled from Muskota late winter this year, it was late winter this year. So looking forward to those coming available soon. So that's all I have for tonight. Thank you, Steve.
All right, thanks, Tammy. Any questions for Tammy? All right, appreciate it. Chris Kosmowski from MDARD, any updates?
Well, good evening, everybody. I reported last time, I don't have a lot to update you on other than to say that the crop samples are still on track to being analyzed by the end of the year. So we're looking forward to that information, but we don't have anything to report at this point.
Gotcha. Well, thank you. All right, any questions for Chris? All right. And looking down the list here, I see Hal Zwang from MDOT. Any updates from MDOT, Hal?
Yeah, I can report this evening that we did successfully award and distribute the whole $4 million in grant money that was allocated by the legislature for fiscal year 20. We went through 2 rounds of solicitations from airports. This money was earmarked for airports to be able to do some testing and characterization to determine the extent of PFAS contamination on their airport sites. So those grants have all been awarded. The contracts are all done, and look forward to working with the airports to work through those projects now.
All right, thanks, Hal. Any questions for Hal? All right, and anybody from DHHS, Deb, any other updates you want to interject now?
So we are continuing to plan for our Michigan PFAS exposure and health study in Parchman Cooper Township We're hoping to get that clinic started by the end of the year. We've got a couple clinics getting set up now. We're also continuing to plan for collecting information from participants next calendar year in spring of 21 for our Michigan chemical exposure monitoring, where we're going to do about 200 different chemicals across the state from a representative sample of adults to develop a state-like NHANES data that Yost was talking about. We were using the national data to compare blood levels. So we're going to be doing some collection next year, starting our collection. It's a 3-year collection schedule. We'll start that next spring. We're also in the planning stages and trying to get ready to also start collecting PFAS blood levels from firefighters across the state, also starting next spring. We continue to do resampling at site of drinking water wells across the state to see if the levels are remaining similar to the initial sampling that Eagle did, and we're also looking to see if those that we have provided are effectively removing the PFAS from that drinking water. I'm going to see if Marcus has anything else for us to add at this point, but that's the majority of the work we've been doing. And if Marcus has anything else to add, I'll let him do that now.
Looking over my notes, I think you are good, Deb. Thanks for your update. I have nothing new.
Okay, thank you.
Yeah, thanks.
All right, thank you both. And I can't tell who all the phones. Did I miss any of the other agencies? And Ian, is there any quick updates you want to provide on rollout of the MCLs?
Thanks, Steve. Sure, I can give a little bit of an update. Nothing super new to share other than we are in the midst of the first compliance monitoring period for all of the supplies required to sample under the MCL. So we have not received many results. We have received a few. We expect that rate of receipt to begin to tick up here as we get closer to the end of the year and the end of the first full quarter here on December 31st. I think that's all I've got to share. Thanks, Steve.
Well,
Thanks.
Thank you, sir. Any questions for Ian? Like somebody might have had their hand raised. Arnie.
Just a quick question. Now the MCLs are totally promulgated and effective. What's the status and when should we expect rulemaking on the groundwater criteria and cleanup criteria for the other 5 PFASs?
Yeah, thanks for bringing that up, Arnie. As we've talked before, those other 5 PFAS compounds, before they could become cleanup criteria under Part 201, we've got to go through a rulemaking. And that's the same kind of rulemaking process that are very similar to what the MCLs went through, where we'll start with, listening sessions with stakeholder groups, develop a draft, and then, submit it into the Michigan Office of Administrative Hearings and Rules, work with the ERRC and JCAR through that process, which I will tell you, my impression was, and Ian, probably will verify this, that the MCLs went through in pretty swift time. And just because we had, 7 agencies and a lot of really good stakeholders working with us to get them through, I don't know that, what the timeline is going to be for any other rulemaking on PFAS standards, because I know also there's questions on other media like soil where should we be with, standards for PFAS in soil, whether it's total or leachable amount of PFAS in soil. So appreciate that. And AJ,
Well, just quickly, as it started, at least on the technical side of it, and is there a work group, and which agencies are part of that team? And will our community group have a role, at least to start?
So in reverse order, yes. And I think you'll see a very similar rollout to what you saw with the MCLs, where Eagle went out to stakeholder groups and got input as we were trying to put together a draft package. And, do our scientists look at standards and criteria on a regular basis? Absolutely. They're monitoring, the evolution of the science, not just on the standards that we have today for certain compounds, but on whether or not we should be regulating others. And so, various programs, surface water, air, the cleanup program, and as well as, DHHS is constantly looking as well at, what does the science say about whether we should or shouldn't have standards or at least screening criteria for any of the PFAS that we're investigating for. So I would say stay tuned. You'll be seeing something soon on this. I just couldn't tell you if it's next week or 3 weeks from now as that process gets kicked off. It's a very deliberate process that we have to go through.
Okay, thank you.
Yep. All right. Thank you. And AJ, I see your hands up.
Yeah, just a really quick follow-up on Arnie's comment. And that is, I think everyone just breathed such a huge sigh of relief when the MCLs went through for the, 7 compounds. And it was so fortunate that, for the 2 main ones, PFOA and PFOS, we had, an existing cleanup criteria. So those became Part 201 groundwater cleanup criteria real fast. I think there's, I wouldn't say that there's a situation where there's no interest in proceeding with that, but it's a question that's been asked: when will the next step be taken to get the remaining 5 to have them be 5 Part 201 cleanup criteria for groundwater? The question I guess I had for you, Steve, is do you get the feeling that there's going to be the need for significant new science to support, implementing these existing standards as groundwater cleanup standards too? Or, I always thought it was going to be, it wasn't that long ago that the science folks got together and said there's a need to make sure that folks aren't drinking above these levels, and that generally there's a policy decision to, maintain our groundwater in Michigan to drinking water standards, that there didn't need to be a whole lot of new science that needed to be done before we could move forward to cleanup criteria. So I guess, and it's kind of largely Eagle, maybe RRD focus, but it's something to, I don't think there's going to necessarily be an answer to that question right away, but one of the things we're interested in, I think, as a group of citizens is, are we going to have to reinvent the wheel to turn these drinking water standards into cleanup standards, science-wise?
So I'll give you Steve's impression here. The answer to that should be no. And I don't want to poison the well or, predetermine anything. There is a process they have to go through, but you also know that the administration has prioritized clean drinking water for all residents. And, that's where a lot of these cleanup criteria come into play, is when we're dealing with, residential wells and whatnot as well. So, my thought on this is we should be aligned, at some point. It's just a matter of the regulatory structure that gets us there. What I was thinking about as well is with, changing science, whether or not for the existing criteria, I wasn't thinking specifically MCLs because those are so fresh, for lack of a better term, but, other criteria, whether it's, any other media, and as well as whether or not there's other PFAS compounds that we should be bringing into the fold, so to speak, with, starting with screening criteria and ultimately ending up with other regulatory standards. As you recall from reading that report from our science advisory work group, they told us we ought to be revisiting this stuff on some routine basis, whatever makes sense given our regulatory structure and whatnot here and capabilities in Michigan. So anyway, I'm hoping that things are aligned sooner rather than later.
Excellent. Thank you.
Yep. And are we covering the comments in here that we're seeing in the chat? So anybody feeling their comments have not been addressed in the chat, because I haven't been able to talk and read at the same time. All right. Well, good. All right. Unless there's anything else on the agency updates and those comments, let's move on to next steps. And really, the next steps, a couple of things is just we've got some future meetings on the calendar. And to that point, ideas from you all on what you'd like to see at these upcoming meetings from an agenda perspective. I'll kind of open that up and see if anybody has any specific ideas. We can always fill these agendas, and you guys are great with the conversation, the dialogue, but are there specific things that you would like us to work on? We know we'll start talking about, the studies in the Rouge and E-course in Southeast Michigan in January, but next couple of meetings, thoughts? All right, I see somebody. Daniel, you've raised your hand.
Yeah, so I was actually just thinking about this to myself, and so I'm of two minds. It is really helpful to get a broader sense of the issues that are out there than any one of us or any few of us would be thinking of. So I think there's real value in having your team select certainly the topics, because many times there are things that I look on at the agenda and think it's not clear how that would interface with my own work, but then after listening to it, it gives me some helpful perspective. So there's a lot of value in taking sort of that wide angle lens and seeing how this all fits together. A lot of times those are topics that I necessarily wouldn't have thought of. Thinking ahead to specific topics I'm interested in, the work that Tammy described, anything regarding foam certainly is going to be near the top of our list. Anything regarding the other PFAS chemicals that we know are out there, but that right now less is known about. Would be interesting. But I would say, just generally speaking, how PFAS moves through ecosystems and, what are potential impacts? What are studies that have happened elsewhere? I know a lot of that is longer term than just thinking over the next few meetings, but sort of broad categories. It's where are the areas of emerging research that we need to be proactive about? I think those are the things I'm interested in.
Good. No, thank you. I appreciate that. One of the things that we thought that we could do as well, and these don't have to be real long pieces of the agenda, is starting out program by program on some of our authorities and how we address PFAS contamination, responsible parties. And so that could be something that we can add on to some of these future agendas as well, maybe starting out with Part 201, the cleanup statute. But clearly there's many other drivers for addressing contamination. So that comes out of the MPART team, thinking that might be helpful.
Yeah, Steve, this is Tammy. I just wanted to reflect on what Dan was saying, and thanks, Dan, for your interest in the topics I brought forward. When Steve showed the slide about the budget, he was correct. It showed 2.2 million. There was the 2 million, which was for chronic wasting disease, but there was 200,000 that was in our budget that we were going to use to really investigate waterfowl issues. So right now where we're at, and we're happy to talk about what we're doing right now and what the investigators that we're working with are doing right now, but we are actively looking for external funding to sort of take the next step and broaden that inquiry with wildlife populations and try and get some more understanding there. So I just wanted to take a second and just comment on that, Dan. Thank you.
Excellent. Yeah, thank you. Thanks, Tammy. And Bob, you had your hand raised.
Yeah, very simply, technologies, the emerging technologies. One for the testing. Are there any new low-cost testing opportunities coming out to test our well water? Something less than the $250 or $700 or whatever it is today. And also new cleanup technologies you said might be coming out in the fall. If you have any reports on those kinds of technologies, they'd be very interesting.
Good, good. Yep. There's a few things that we can talk about in there on what we're trying to do to at least facilitate or promote more research in those areas. So we can include that as well. So there's quite a few things happening right now. So yeah, thanks for that. All right. And I see Connie, your hand was up.
Yeah, I would like to, I agree with Bob. There is some new technology coming out, cyclodextrin-based absorbents to remove PFAS and all their constituents. That's going to be something that's going to be marketed by the private sector very soon. So I think we really should be on top of that. And so I agree with Bob on that. The other couple of things is, we focus so much on drinking water, and I'm 100% for that. But a lot of people's water can be contaminated when that contaminated groundwater hits the surface water and then flows out, like along the Lower Rouge River. What I would like to see is an emphasis by Eagle to focus on studying all unlined landfills ASAP in the two largest counties or three largest populated counties. Because that's what, they're the big sources. They're one of the big sources of PFAS, and we're just not really paying attention. Other things I think that's really important is we're not really focusing on sources. Like you had Lake Marguerite there in Gaylord. Well, you've been testing that since 2017. Okay, have you identified the source yet? This is 3 years, going on 4. Has that been done? We need to identify the sources so we can control it. And I think the sources are, like I say, the unlined landfills and the other things I mentioned. The other final question is this. Okay, we have focused on places like Wurtsmith Air Force Base, but what about Kincheloe Air Force Base? What about Selfridge Air Force Base? Are we just not going to look at those? So I think there's several different areas that we need to start going on. It isn't just identifying the sources like the unlined landfills, the military bases, but it's also what can we do to remediate this ASAP? And most importantly, what can we do to get rid of PFAS in food packaging, which is contaminating our food? Why isn't Eagle doing a lot more to get people away from all this packaging? I mean, I have very little organic garbage. The most of it is packaging from the stores. So we've got to work on several different initiatives at one time to get our hands wrapped around this issue. Okay, that's it, Steve.
No, and thank you, because you've basically told the MPART story. We've got a story behind each one of those that you talked about. whether it's these other locations and different sources. And, even we, working with the legislature on the recent bill for prohibiting the practicing with the AFFF that has the PFAS in it. And so, yeah, I've made some notes here. There are some things that we can provide some updates on as well.
Oh, one last thing, Steve. And I'm going to really, oh, wait a minute. One of the key things is Governor Whitmer is really pushing for money to be put into water infrastructure, drinking water infrastructure. But she is really missing the boat, and so is Eagle, when you do not protect wetlands, because they are God's creation to try to protect our drinking water. And we go and decide to destroy 44 acres of wetlands so a landfill can build on it. That doesn't make any sense at all. Use the natural wastewater treatment that you have in wetlands. Please use that. And instead, you want to throw a whole bunch of money into, doing man-made things. Why don't you focus on what is naturally there to protect our drinking water? And I think that's very important for keeping PFAS under control, which is why I'm mentioning it. All right, that's it, Steve.
All right. Thank you, Connie. And that's a much bigger discussion even beyond PFAS, but I appreciate your thoughts on that. All right. Any other questions, comments? Kind of hard to follow here, but I thought I saw a hand go up and down. Not sure who it was. All right. Well, that last slide there showed that there is a, what is it, a webinar tomorrow on the governor's clean water plan, and it's more intended for local officials that run these systems and how they may get at some of these dollars, for lack of a better way to say it, for infrastructure improvements, not just PFAS, but just water infrastructure, even wastewater. We have programs for all of that. And, but you might find it interesting, especially to understand what options are available for communities. So if you are, I'd encourage you to sign up for that. It's tomorrow. Some of you may already be signed up for it. And let's go on to the rest of the round robin here and see if there's anything else that folks wanted to remind everybody else about. Any announcements, updates, and other questions? All right. Hearing none, I think we can call this evening to a close. A few minutes past our time, but I appreciate everybody hanging in there. Really good conversation tonight. I appreciate that. And Kelly, anything else we need to do before we wrap this one up?
Not that I can think of. My kids are lining up behind me.
Okay. All right. Well, hey, thanks everybody. You have a good night, and we'll look forward to continuing to work with you. And remember the PFAS Summit and Citizens Panel at the end of the month. Make sure you sign up for that. I'm sure that everybody will learn from that one as well. So have a good night, folks.
All right, bye.
Thanks a lot.
Thanks.
See you.
Thanks, Steve.